Hello, welcome back to the Mid-Modern Eye Care YouTube channel. Today we're going to be discussing one of the three big dry eye treatments that we do here at the clinic, namely the IPL laser machine. First of all, a couple of semantics. It's not actually a laser. It is classified as a class 4 laser, but it uses a broader spectrum of light than most lasers do, and we can actually vary the wavelength of the light pretty easily with it. Anybody out there saying that's not a laser, you're right, it's not, but it's classified as one still. So what do we use IPL for? First of all, IPL stands for intense pulsed light. A little bit of background on IPL. So IPL has been around in dermatology for probably the last, well, from the 2000s. So currently at the filming of this video, the last 20 years or so. It's been in the last probably 10 years that we started to discover, hey, our rosacea patients that get IPL done, their dry eye improves. And so there've actually been a few studies, and this particular device has FDA approval for the treatment of dry eye. This treats what I call obstructive dry eye. So that is the dry eye, if you've watched the other videos, that is caused by the oil glands in our eyelids not producing oil and being plugged and being clogged. When our oil glands don't produce oil, then our tears evaporate too quickly off the front of our eyes, and we're left with our eyes feeling, irritated or red or tearing up or not. Any of the typical dry eye symptoms. This is part of a 3-step process. So this reduces the inflammation in the oil glands, and then we couple it with the masking procedure to open the oil glands back up, and then we couple that with a thermal lid treatment to get the old oil out. So all three of these treatments work very, very well together. A couple of things to expect with this treatment. It does have some, I'll say, positive side effects. So IPL is also used somewhat, not this one, but somewhat used in the kind of beautician cosmetic aesthetics world because it can reduce darker blemishes on patients with fairer skin tones. It can also tighten the skin slightly, which can actually be very helpful for patients that have looser eyelids. This procedure can help sometimes, not always, but it can definitely help with some patients. On the day that you have your IPL procedure, it's important that you come in not wearing any makeup, especially eye makeup, but including foundation. Also, you shouldn't be using any retinol products when we're doing IPL procedures. Most patients need about 4 IPL procedures over about a 3-month period. So about every 3 weeks we need to do one of these treatments because the treatments build on themselves. Occasionally, very severe cases might need a 5th treatment, or if there's some really bad rosacea associated, sometimes there are more treatments needed for that. You may see somewhere on the internet about like a rubber band slap feeling. The way I do it, you don't really notice that. It can feel warm, kind of tingly. Couple of reasons you don't really feel that. I do treatments in 2 stages. So I treat your eyelids separately from your forehead, your cheeks, and your nose. The reason for that is I have different settings in the machine. Another common question that I get is, well, why do you treat my nose and my cheeks and my forehead? The best analogy I use, when you're weeding a garden, you don't just pull the weeds at the base of the plant, you weed out from the base of that plant because that's the best way to keep weeds from growing back in and competing with the plant. So as we reduce the inflammation generally in our face, it helps to reduce the inflammation in the oil glands. So another common question I get is, well, how does this work? One of the main pigments in our body is hemoglobin. So that is in our red blood cells. It's part of the red blood cell that helps bind oxygen and carry it throughout our bloodstream. This machine treats inflamed blood vessels. The easiest way I explain it to patients Inflammation causes or can cause blood vessels to grow that shouldn't be there. Those blood vessels are not very good. They're leaky, so they let white blood cells out, they let other inflammatory markers out, and they increase inflammation. So as we treat and get rid of hopefully most of those blood vessels, that reduces inflammation. So why on earth does reducing inflammation in blood vessels, why does that help our oil glands? Well, our oil glands, because they are producing oil, they use a lot of energy. And so they have a blood supply that goes to them. And if that is inflamed, the oil gland gets inflamed. Kind of the easiest way that I can understand and explain to patients why we use IPL. If you have any questions about IPL or any of the other dry eye procedures we provide here at Mid-Modern Eye Care, please feel free to reach out or leave a comment below. If you are not currently one of our patients and you don't live close enough to visit us, please find a very good dry eye care provider in your area and get a proper diagnosis. That is absolutely key. And remember, you have two eyes and one of them is not just a backup. Stay safe out there, and we'll see you in the next one.